Good morning, everybody. A little louder. Buenos dias. Well, welcome to the 4th Annual Consumer Health IT Summit. We also have a large virtual audience out there, and so I want to welcome them as well as welcome all of you, and thank you for taking time out of your lives to join us today and help us kick off National Health IT Week here in Washington and across the country. We'd like to begin this week with the most important stakeholder in all of this, which is, of course, the consumer, the patient, the person that we're all here to serve every day. Today we're going to celebrate how health IT supports our healthcare system and moves us towards delivering better care that's more affordable for everyone and ultimately improves everyone's health. Today's summit is going to celebrate advancements in the work that we are all doing together to empower Americans, such as tools like Blue Button, which gives us simple, secure access to health information when and where you need it most, so that you can not only improve your own health, but become more engaged and empowered in the healthcare team. We are expecting today's summit to be very interactive, not just because we have 400,000 things on the agenda, but because we want you to also participate throughout the day. In particular, if you're able to tweet and interested, use the hashtags Blue Button or NHIT Week, and we'll be monitoring those tweets in real time and integrate them throughout the day as ideas and questions arise. Before we get any further, I want to start by acknowledging Ligia Ricciardi, who is here with us today. She recently left us at ONC after 3.5 years of service, where she spearheaded the development of the Consumer eHealth program in the office. She was our first and probably our only ever consumerista, a position that Jody Daniel, who you'll get to meet more later today, the Director of Policy, advocated for and helped to create. Ligia, as you all know, has been a tireless not only worker but advocate for consumer engagement and has put her fingerprints on everything that we do at ONC, and that will not change because she left. It is becoming institutionalized. And so if you would just stand so we can thank you for your service to the country, we'd really appreciate it. And if we had a baton, I would ask her to hand it to Lana Moriarty, who's also here. She recently joined us on detail from HRSA, who was kind to lend her out. She'll be working with the mighty Consumer eHealth team to continue to advance this great portfolio of work. Lana, can you stand so they can see your face? Welcome, Lana. And it's not in my remarks, but maybe the Consumer eHealth team could just stand up for a second. I see Aaron, where's Simone? Just maybe not in here. And Lena also, and thank you all for the work you've done today. This is no small feat, and I know that you've been working tirelessly, including through the weekend. Well, I hope that you all know that I remain firmly committed to and very optimistic about the opportunities for ONC and our federal partners, as well as the private sector, to support consumer engagement in a meaningful way that means not just sharing information, but truly empowering patients so they have a voice and a vote, decision-making about their health and their health care. And as you all, I hope, know, interoperability has been our top priority at ONC. But the guiding principle around that is that advancing interoperability is really the means to the end. It's a way that individuals' health information is easily accessible to them when and where they need it to help save their life, to improve their care, to make them more empowered for all the uses that they determine about their own health information. Today's lack of interoperability in health IT systems does result in gaps. It results in missed handoffs that can cause unnecessary inconvenience. It causes children to have to be stuck twice, people to have to miss work so that they have repeat tests, and in some cases it might even cause harm for consumers. But consumers can help us play an increasing role in interoperability. They serve as a medium of exchange between multiple providers and members of their care team to ensure that that right information is available at the right time. And it comes at an exciting time in healthcare as we begin to evolve with tools like Blue Button to support consumers, because really that harnessing of health information is going to transform the healthcare system into one that meets the expectations and needs of everybody in this country, including those that we're here to serve. The amount of information available is increasing so that it is going beyond what's in your your electronic health record, thanks in part to programs like Meaningful Use, but also to changes and improvements in programs like CLIA and HIPAA. This morning you'll be hearing more from our new director for the Office of Civil Rights, Jocelyn Samuels, who will discuss the clinical laboratory improvement amendments and the work that our office has done with theirs to see that this landmark rule can give patients and their personal representatives access to their lab studies when and where they need it. Similarly, you'll learn more about the Meaningful Use 2 program, a policy intended to liberate health data to get it into patients' hands through efforts like the View, Download, and Transmit. Meaningful use is not the only lever for advancing consumer engagement, but please remember that it's an important one, and we have to continue the march ahead. To monitor these programs and other policies, we really encourage you to stay tuned to our website, to healthit.gov, where not only did we have a recent blog, but we're going to have some recent data coming out, and I want to show you some slides about the information that we're collecting to help us understand what consumers want and expect from their healthcare data. I don't know who's doing my slides. Thank you. First of all, this survey, I should tell you, is of about 2,000 folks who took the time to respond and share with us their views and perspectives about how they are having access to their health information, what they would like to do with that health information if they had it, and what sort of barriers that they're meeting. And I'm going to race through the top line of these in the interest of time, but again, point you to our website, healthit.gov, so that you can find more information in a more detailed white paper. What we know right now is that nearly 1 in 3 people experience gaps in health information, and that this is really critical data that they need to help them find out the information for their own health and health care. Next slide. We know that their ability to address those gaps and delays is limited, that really only so far about 3 out of 10 people have been given access to an online medical record. Next slide. And among those offered access to their online health information, almost half viewed their information once, which is a great start, but as consumers, we want to encourage people, when the information is there, to keep using it so that the demand doesn't go down. Next slide. We also know that people use this online information for a variety of purposes, that we see that there is variability in what they do when they have that access. Most of them use it to monitor their health, but about half want to share that information with someone else, usually a member of their family or their care team. They want to download it to their own devices, computer or otherwise, so that they have it available for subsequent visits. And then sometimes they're using it to put it into a personal health record, for example. Next slide. Here's what we do know, is that when people have access to their health information online, they find it useful, and they want more of it, and they will use it for multiple purposes. Even among those who didn't have access to their information, a majority, 62%, thought that having secure online access was very or somewhat important. We didn't ask why, but we would speculate that having it available in case of emergency may be one reason, but I think you all know that because you want it for you every day to make the right decisions for your own health. Our hope is that this data and others that you'll find on our website will inspire more questions and conversation about how we can help people play an active role in their health. And I want to tell you that we're continuing to conduct this survey to really help us understand how to shape policies and programs and the conversation with you all. It helps us to think through the next stage of the work we will do at ONC on your behalf. That an interoperable healthcare system with the person at the center must leverage information beyond what is captured in just the clinical environment. We are seeing increasingly that consumers are demanding that their health information not only include the observations of the healthcare system, but includes an opportunity for their own information, their own perspectives, their own personal generated data, their own genomics, their own Fitbit data, has a space, a room, a place within that health record for them, that this is about health information beyond electronic health records. We're going to have a robust discussion later on today about the challenges and opportunities associated with incorporating this data, but just because there are challenges doesn't mean that we should stop. It's not just a good idea, it really matters for people's health. And this afternoon, we're also going to learn more about Blue Button from an old friend, Ryan Chadsarum, former Blue Button fellow who's now the deputy CTO at the White House. And I want to take a minute just to really thank the White House for their continued involvement and engagement in the Blue Button effort. It is really their march forward that helps us remember all the time how important it is to empower people with their online records so they can make use of them and lead healthier lives. Access to health information is important because of what it enables people to do, not just in the experience of checking your health records to be empowered to better manage your health, but also so that you can check those health records to ensure their accuracy. This is about safety, but it's also about the conversation between the consumer and the healthcare provider. The health information in those records and beyond is a way that we help Grandma not get readmitted to the hospital so that she can stay home with her family and loved ones. It's a way that a veteran can have their care coordinated outside of the VA system as well as within. It's a way that people can self-manage their care for hypertension or other major cardiovascular disease risk factors. It's a way that people can find out about a clinical trial that might be suitable for them for their rare or unusual disease. And in times of disaster or emergency, it's a way that that information follows you so that you can continue that care you need without any interruption. Many exciting innovations are allowing patients to now access health information. Their self-management tools, their care team can improve their health through those partnerships by providing that as part of their personal health records, but also there's an increasing amount of innovation in the entrepreneurial space that is helping us to really advance the development of health information. Blue Button is one such entrepreneurial opportunity, and we're going to kick off today a new Blue Button campaign that is going to really explode, we hope, the awareness and the demand for Blue Button as a consumer-mediated exchange opportunity, a way that everyone who has that kind of access can really demand the data so that it is more available and learn the ways that they can access it. And I think we're going to take a few seconds just to watch a quick video if I can get Brett to
You are the
cue
keeper of the healthcare information. You know your systolic and your diastolic blood pressure. You know your medications, your cholesterol levels, and your blood pressure readings, even your blood glucose readings. You are the one person who can remember and share every single detail when you need it with your doctors, family members, pharmacists, home health providers. What if you were unable to recall your medical information and the best treatment was delayed, waiting on that vital data only you had in your head? Now, with Blue Button, you can have reliable online access to your personal health information anytime you need it. Your health information may be available for you to access online, and you have every right to access it, check it, use it, and share it when you need to. Visit healthit.gov/bluebutton and take control of your health. With Blue Button, the power of your health information is in your hands.
Yay! Go to the next slide. Thanks. So I'm running out of time here, which is not a good thing because you're going to be a couple minutes over because you're going to have to hear about my jacket. So let me just say that these are the partners who have agreed to push the Blue Button information out on their website so that it is available, so they have information not only about how to find the link, but also more information about Blue Button itself. We have several partners in the audience that may be here. Teresa Hancock from the VA, Lloyd Bass from Live Strong, Kim Fox from Everyday Health, Donna Howes from ShareCare, Steve Thornton from the Indian Health Service, Dr. Charters and Stan Amadis from TRICARE, and Patrick Jordan from the New York Presbyterian Hospital. So just thank all of them, and if you see them today, tell them how much we appreciate. This is like one of those secrets in healthcare that we want to continue to push out and make sure folks know about. If you're not as familiar and you want to learn more, go to healthit.gov/Blue Button, and you can learn oodles about what Blue Button can and has done and how you can continue to push it out. Wow. All right, I told the team that was policy Karen, and then I was going to turn into Karen, which might frighten some people. But I wanted to tell you that all this matters. The policies that we set at ONC, we have a belief that the consumer's voice matters, and it shouldn't just be a voice, that it should have decision-making authority. And I wanted to share with you a little bit about why that is, and why it is important to me that that voice is as diverse as possible as we move ahead with the work that we're doing at ONC and in this country. You can show the jacket if you want. So I'm now a member of the Walking Gallery, thanks to Regina Holiday. If any of y'all have been through this experience, I'm sure she's a professional counselor, because she manages to get you to say things that you might not say to others. And I will tell you all, since I have 2 seconds left, that the story will be posted on her blog, which the name is too long for me to remember, but she's going to tweet it, Regina Holiday's Walking Gallery medical blog. So there is a longer story, and it's called The Legacy of a Free Lunch. So let me try to be short and tell you a little bit about what's in here and sort of what makes me tick. So I stand before you today, the legacy of a free lunch. What does that mean? That means that actually against many odds in this country, I came out of poverty and a place where we didn't have many tangible resources in the sense of goods to fulfill a dream of becoming a doctor so that I could have the joy of taking care of people and being a part of their lives in that intimate and special way that only the doctor-patient relationship, in my opinion, can confer. And that I would be able to give back in a way that people had given to me. But I did not have a resource-poor childhood. I was raised by a woman named Elaine Bollinger, who is not with us anymore, but she was the kind of person who, in spite of her challenges and struggles, loved people unconditionally, including us, didn't judge, didn't create hierarchy in the world, and found a way to give back no matter what her struggles might have been. When she was raising the 3 of us as a single parent after my dad left, she worked full-time and still found a way to go in the middle of the night to pull shifts at what in the 1970s we called the battered women's shelter, so that she would be able to help women who had even less than she did. And being raised in that spirit, I think we also were really conscious of the fact that sometimes we were living a little bit day to day, and I got a lot of help from programs like the free breakfast and lunch program, which has its good and bad, but it did feed me, and I'm thankful for that, as I am thankful for a lot of other ways that people in this country helped us to get ahead, whether that was public schools or the National Health Service Corps to pay for medical school. And so that part of me that comes from a place of not having the resources that many people have or take for granted, coming from a place where sometimes you can feel voiceless in a broader society, and a place where those who need the most help sometimes are likely to be the least to get it, is something that I get up thinking about every day. And it is the way that I try to do my work. I try to live up to her expectations of me as a person who cares, first and foremost, and who is open to understanding the context of people's lives, where they come from, where they live, learn, work, and play, and to always trying to be a better person and to make the world a better place. A lot of y'all know the story of Katrina, and I'm not going to belabor it. She talks about it a little bit in the blog, but I think that work was just sort of, I'd say, a natural instinct and an outgrowth of the way that my mom, Elaine, raised all of us. So you can read more about the details of it, but it's a beautiful gift, and I know it's for the country that you painted this and not for me personally, but I really thank you for getting me to share my story. And I hope that, I guess, for all of you with whom I have the joy of working and trying to advance this goal of seeing that the digitization of the content of the health and healthcare experience can democratize and empower in a way that we may have never been able to do before because of the sheer hierarchical nature of paper, how hard it is for that to flow as freely as we want it to with our permission. But how empowering that's going to be to everyone in this country when we figure out a way that that data, that information, is available for each and every one of us, no matter the color of our skin or where we reside or the kind of payer we have or the kind of provider to which we go or the kind of healthcare challenges or health challenges that we might have. Then I think we're going to get to a place of equity in this country that's going to really let us move forward. So thank you all very much.